Hi, I'm Dr. Tiffany Powell-Wiley. I'm a cardiologist and epidemiologist. I'm also a scientist at the National Heart, Lung, and Blood Institute as a part of the National Institutes of Health. More importantly, I'm a proud member of the Association of Black Cardiologists. I'm here today to talk about obesity and how it is a risk factor for cardiovascular disease, but also how it impacts the Black community. Obesity is defined by body mass index, and that's calculated or determined by one's weight indexed to their height. And it tells us how much excess body fat a person has. A body mass index at 30 is the definition of obesity, but a body mass index at 35 or at 40 or higher puts one at particularly higher risk for cardiovascular disease. So the question always is, why is obesity such a risk factor for cardiovascular disease? The main reason, and what we're learning more and more about each day, is that the excess body fat that one has actually produces inflammatory markers that put you at risk for developing cardiovascular disease. Those inflammatory markers can actually affect your blood vessels and lead to the development of cardiovascular disease. We know that, particularly for Black women, we have the highest rates of what we call class 3 obesity, or having a body mass index at or above 40. Obesity is complex. That's very important to recognize. It is not just related to what you eat or how much exercise you get, but it's also related to what you're genetically predisposed to, as well as psychological factors like depression and stress, as well as discrimination, but also what your environment is, how safe your environment is, how you even feel about your environment, how safe you feel within your environment, and what resources are within the neighborhoods where you live. Because obesity is so complex, it makes the treatment of obesity very difficult, but there are treatment options available. There are ways in which we can change our diet and change the types of physical activity we do to promote weight loss, but also to promote weight maintenance, which is important as much as weight loss is important. It's important to think about how do you maintain a healthy weight over time or prevent weight gain over time. We can think about having a diet that is high in vegetables and high in lean meats or lean proteins, and really think about how do we incorporate some of those healthy foods into our diet. The other thing to think about is getting the activity that we need. It's important to try and get 30 minutes of physical activity every day, even if that's walking around your neighborhood or doing activities in your home that you enjoy. It's not only important to think about diet and exercise, but it's important to think about medications that can potentially help you lose weight. For instance, there are medications that are that we know can help in weight loss, but they can also help in reducing your risk for cardiovascular disease. We also know that an important treatment for obesity is bariatric surgery. And that is a treatment that we think about, especially when one's body mass index is above 30, but also when they have risk factors, including diabetes, that can affect their risk for heart disease. Bariatric surgery requires consultation with a surgeon who specializes in that field But it also requires the same things that you would need as far as changing lifestyle, getting into the habits of eating a healthy diet, and getting into the habits of getting physical activity, even before you consider surgery, but also after surgery. Most of all, it's important to think of treating obesity as a continuum, and it starts with lifestyle changes, but can move to medications or bariatric surgery as needed. For all of us, it's important to think about how do we incorporate healthy lifestyle into our daily lives, whether it be with our diet and with physical activity. Most of all, it's important to remember that obesity is a complex disease that affects cardiovascular disease risk. There's many things that we can do as individuals to reduce our risk related to obesity, but we also know that we need to advocate for policy changes that make healthy choices the most easy choices. Thank you for your time.